And so today we are going to do, I'm going to speak about navigating changes to your NDIS plan. So I haven't done a webinar in a while, but we're going to talk today about what to do or what to expect if the NDIS changes your funding, what to do if a service provider makes changes that impact your funding, and what to do if you need to make changes to your funding. And then we're going to have some questions at the end. And so I'm going to, before I start, I'm just going to begin today by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders past, present and emerging. I'd like to extend that respect to the Aboriginal and Torres Strait Islander people here. So what to do or what to expect if the NDIS changes your funding. So the NDIA can only, just so you guys are aware, the NDIA can only change your funding if there's a plan reassessment. That can either be a plan variation or a full reassessment of the plan, but it's only at that point where your funding essentially changes. And so they will review what's in your plan, and they have every, I guess, they have then access to making changes in other parts of the plan if they feel like it is not in line with reasonable and necessary or not in line with the legislation. So a plan reassessment, it can be requested by the NDIA. So typically when the plan rolls over, which we have experienced, often people have experienced a number of times since COVID, when they started this rollover of plans. So if the plan has rolled over for a couple of years and there are no documents on file, like they're a bit outdated and everything, that's when the NDIA may say, we need to have a conversation and make sure the supports are in line with reasonable and necessary and your circumstances haven't changed or anything. And then they will ask for a conversation regarding that. Sometimes they'll roll it over longer than that, like for a third year, but usually it's a couple of years and then they will ask for a conversation. Plan reassessment can also be participant requested through a change of situation form, or it can be requested through a scheduled, like 100 days out of the plan expiring. You can you'll have a check-in and you can ask for a meeting to reassess the plan, whether that is a plan variation or a full plan reassessment. If you've not needed a change in situation and your plan's coming up for review, you can expect that 3 months prior to the expiry, you'll receive a phone call or a letter with a check-in, and they'll tell you at that point if you're eligible for a plan rollover, or what can happen. So they'll say, you're eligible for a plan rollover. Is everything in your plan working okay? And you can say yes or no. And then you can also then at that point say, no, I'd like to request a meeting. And that's within the 100 days. And that would be considered a scheduled review. And that can either be a variation or a full plan reassessment, which will go into detail about which is which and what you can choose. They can also, once you've said that you're happy with the plan rolling over, it kind of just sits there in the system. And then when it gets to the expiry date of the plan, if the NDIA haven't triggered anything on the system, it will just extend. So you'd have the same start date, but just an end date that was 12 months after. And then if you have a meeting, then if you're requesting a meeting for a variation or a reassessment, it would happen within that 3-month period. So you would, respond to that. I would recommend, and I recommend this in my work and with the participants that I work with, it is best practice. And even if you're requesting a rollover, I would always recommend you update the system or update the NDIA with reports. So you can tell a therapist or a service provider whether you want a end of plan summary or a report or a new quote or anything like that. Even with a rollover, I would recommend this. They will continue to roll over the plan if they have updated reports and quotes on file. They are less likely to do it when there isn't. So if you keep up to date with that every year as best practice, then you are more likely for rollovers to continue, assuming that the plan is sufficient. So you'll need to, you'll need to get the new reports. You don't always need to have new reports. It's either a report or a end of plan summary or a supporting letter. And then it is really important that you ask for updated quotes. We recommend doing this even if you expect a plan to roll over. And you can upload you can either send it into the inquiries email or you can upload it through the portal yourself. So what happens if a service provider makes changes, essentially, is the next thing that we're going to talk about. So at the start of the new financial year, usually the pricing arrangements change. Not usually, every year the pricing arrangements change. Sometimes it happens a couple of times through the year, but most likely it's once a year on the 1st of July. Your plan will be indexed at the time to account for this. So that accounts for any inflation costs or anything like that. They will slightly adjust your plan and give you a little bit more funding to align with that. And essentially how they work that out is your plan is built specifically to support. So they've got to the amount that they've got to in a number of ways, but when they've built the plan, they build it based on item codes. Those item codes in the flexible budgets are removed, and then you've got a bit more flexibility to move around the budgets, but they're still in the system. So when a plan is indexed, they're going off those item codes, and if there's been a change to one of those item codes, and there's been an increase, then your plan will be indexed as a result of that. Because there's plan flexibility for and choice and control and everything, how the plan is used in those flexible budgets may not be exactly how the NDIA have built it in. And so the plan indexing may be relevant or may not be relevant. But if you notice slight changes to your plan at that time of year, that's why. If you're unsure if it has been indexed, you can always call and ask them. Because of the economy and everything, the way it is, services are like the cost for services are increasing, and employees need to be paid based on the SHADS award and different. So these things are changing, which then change how much the cost to the business is. The amount that the NDIA give to an organisation isn't necessarily well aligned with the cost it actually costs to run a business. And so there's we're finding that a lot of places are having to close because of these increases, and it just isn't viable essentially for service providers, and they're having to absorb a lot of those overhead costs, which takes a toll. Providers through this period, obviously providers out there really want to do right by the people and everything like that, but they may seek changes to their to how much they charge. They can't go over the price guide amount, but they can go up to the price guide amount. The pricing arrangements that are available on the NDIS website, they really give a good description. It's actually quite a really good document. They give a great description of the service and what's included in that and what providers can charge, and then the costs of that. You might find that service providers may have been charging under the price guide amount because they were, trying to make it as cost effective for people's plans as possible, but it might, get to a sticking point where they're having to up those charges to be aligned with the service provider, with the pricing arrangements, just to help them be a viable service ongoing. So if a service provider makes changes, they obviously need to communicate that and provide you with some notice and explain where the changes are coming from, what that is, where the amounts are coming from as well. Like, so we are increasing in this area, and this is what this will include. This is who it's relevant to, and it needs to be aligned with the pricing arrangements. They need to provide an updated schedule of support and service agreement. The service agreement, it's not a binding document. The schedule of support is not a binding document. However, it is really important to ask service providers to provide you with these things, because it is essentially helping to understand. It's both parties having it there in writing, agreeing to what service is going to be provided, and what's included essentially. And so if any of that changes, then it does need to be updated. Providing updated quotes and or supporting documentation for the plan reassessment is important as well. It may not be relevant at the exact time to provide that, but if you do have an upcoming plan reassessment or change that needs to happen, or you want to update the NDIA, then requesting that they need to be able to provide that to you. So to ensure the provider follows the pricing rules, they can check the pricing arrangements available on the NDIA website. This, I would say, is when it comes to anything on the NDIS website, you can save it to your computer and everything. I don't advise it. Go straight to the NDIS website. They make minor changes a fair bit. And if you go to the NDIS website, you're always going to have the most up-to-date version. I don't say they change everything all the time, but if they do make a slight change, you at least know when you're going to the website that you're getting the most updated version that they have on the website. So the pricing arrangements and pricing limits you'll get the most information in there. The pricing catalog is just the item codes, and it's not every single item code, it's just the main ones. You want to review invoices carefully. If they need to reflect the price guide, they need to reflect the service that has been provided. You can always ask for a breakdown of the costs if something seems unclear or inconsistent. You can cross-check it with the service agreement to make sure it is well aligned. and you can report any concerns to the Quality and Safeguards Commission if the provider, like you've asked for clarification, but you find that they're just not following the rules. Your support coordinator, plan manager, or an informal support can help with this. And you can always ask the service to speak to them to better understand. So I am aware that a lot of people have jumped on after they received the email last week from around the changes to the pricing for fighting chance programs. And I just wanted to essentially acknowledge that. And we're speaking quite generally today, but I just wanted to acknowledge that people may have a bit would like some clarification around non-face-to-face charges. So face-to-face and non-face-to-face, I just wanted to sort of, I guess, give you the difference. So face-to-face is essentially the support that you're expecting. It's you going into service, or your person going into service, and the active support being provided. Non-face-to-face is essentially still supporting the participant, and this is really important. The support that's provided to the participant, non-face-to-face or face-to-face, always needs to be in line with the participant's goals and needs and everything. But essentially, non-face-to-face support, some of them, not all of them, can be charged. So a full list of what a provider can charge is in the price guide. So the pricing arrangements and limits. And in there, quite soon, I don't know the exact page, but quite soon into the pricing arrangements, it will say non-face-to-face, and it will give you a whole big list and a description of what providers can charge. When you go through, just when it comes to reading the price guide, when you go through each of the areas, so core, capacity building, and capital, and then all of the different programs or supports that can be charged under each of them, it'll have the item code, and then it will have under there what the provider can charge for under that item code. And if under that item code it has a dot point of non-face-to-face, then the list of non-face-to-face things essentially can be charged. So it must be reasonable and justifiable. So they can't just charge for things randomly. It needs to be it's usually not something that they'll know the exact amount of hours that will be charged, because it's something like if you ask for a review letter, for example, that can be charged. If there's a case conference with all the supports in the team to help align what they're doing in that service to make sure, if there's a phone call with the parent or with the person to discuss anything to help them with service, if there are resources and things made up for that individual, not for the whole program, but for that individual, these are types of things that can be charged. There's other types of things that can't be charged, and that is also clear in the pricing arrangements. So if you're unclear, if it says you get an invoice, for example, and it says 3 hours for like day program, and you're like, yeah, cool, he went 3 hours the other day, I know that made sense. And then it had an item code of, or a description of non-face-to-face 1.5 hours. So it was 4.5 hours, the invoice. And you're like, what was the 1.5 hours? You can always clarify. If you get a list back from that provider and it is not in line with the pricing arrangements, you have absolutely every right to go back to them and say, I've looked at the pricing arrangements and they're actually things that are not able to be charged. And so you have every right to do that. And I encourage you to feel confident. The pricing arrangement gives you the answer. And so you feel confident to actually speak up and say, no, I disagree here. And here is where I've got that information. If you're uncertain about doing that or don't feel confident, and you have a plan manager or a support coordinator, they can help. A disability advocate can help. Like, there are people that can help you to speak up for those things if you feel like it's not okay. Just so you know, though, that in the service agreement, it will have a general thing of non-face-to-face. It won't necessarily have a number of hours, which you'd usually have in the service agreement for the active support, because you know how many hours per week. And that's normal and that's okay. And it's unfortunately hard to predict through the year. So if that happens, and just going, so if it you have the provider come to you and say, we're increasing the supports, and you review it with the pricing arrangement, you do the new service agreement, it's all good, and you go, okay, I need to make sure that I have enough funding for this, or I have a little bit of a buffer, especially if it comes to the non-face-to-face stuff. And the non-face-to-face stuff doesn't just relate to programs, or day programs or employment programs. It also relates to therapies. So you want a little bit of a buffer there. So you can explore the existing funding. So the core supports, and I know I've spoken about this before, and I'm not going to go into heaps of detail. There are other webinars that I've done with more information on this, and you can always ask me questions afterwards. But core supports is the most flexible budget. Even with the recent changes to the legislation and everything, core still remains the most flexible. I want to flag one thing though. When a participant gets, and this is where people are getting caught out, and I'm not going to go too much down this rabbit hole, but I do want to flag it. Where people are getting caught out now are there are changes to the core budget when it comes to home and living. So before, there was funding in assistance with daily life, funding in social community under core. They were two of the subcategories. And then you had transport and consumables and stuff. If the funding was managed the same between assistance with daily life and social community, it was quite flexible between the two. So you could use it interchangeably. When people get home and living funding now, that is a stated support, and it cannot be used flexibly with social community. There are ways to navigate that, but just so you know, it is quite separate and it can't be used interchangeably anymore. So people are getting caught out when it comes to day programs and employment programs, because prior to that change, they have just used the assistance with daily life and social community flexibly. When you get home and living, assistance with daily life does not get funded. It's replaced by home and living. So I would just be mindful of that. If you are, or your person is going down the path of home and living, you need to make sure that in social community, there's sufficient funding for programs. So core is usually the most flexible. Capacity building is not flexible within subcategories. For a program like Jigsaw, it's important to know, is your funding coming from core, or is it coming from finding and keeping a job in capacity building? Then you would have the core coming under core will be slightly more flexible if you don't have the home and living funding. Capacity building is less flexible. So you need to see, capital supports are generally not flexible, and it's not relevant here, so I'm not going to go into it. You can rejig things essentially. So you can go, okay, I need to sit down and work out my priority for me is that I attend the program 5 days a week. We're seeing that there's going to be an increase to supports to well align with the price guide. So I need to kind of make sure there's a little bit of a buffer there. So I'm going to have to rejig things a bit, just so I have a little bit left over just in case. And so you can always do that, and you can do that by looking at your service agreements and kind of making up a budget and having a look, projecting that cost. You can speak to the support coordinator or the plan manager to help you with that as well. Essentially, you want to extend the plan, extend the funding, stretch it out until you're at 100 days, and then you can ask for that variation of the plan. But it isn't actually a bad thing either. We want to always make sure that the funding used in a plan is used really in a way that's always helping towards the person's goals and everything. And so sometimes I find people who haven't looked at the budget or have just kind of, a bit like, not so aware, will be using services that aren't actually helpful to them. So it isn't a bad thing to keep on top of reviewing it and making sure, like asking the question, is this working towards my goals? Is this actually a support that I need right now? So if you feel like the funding is not enough, after you've done the budgeting and stuff and you're like, this isn't going to stretch, it's not enough, there are two options. So if you've just got your plan and you have the quotes that were put in at the review, but the NDIA didn't listen, they cut the funding, which happens, and you're like, I can't even make this stretch. It's going to be too much risk to my person or to me. It's not going to stretch. You can do an internal review request. And that's within the first 90 days of the plan being approved. You can put that internal review request in, and we'll talk about that in a sec. Or you can put in a change in situation. And in that, and I'll talk about that in a minute of how to do that, but in that you can request either a plan variation or a full plan reassessment. So plan variation are minor changes, one or two things. Plan reassessment is two or more. The NDIA will review that form, that request, and they will make a decision whether it's internal review request or a change of situation request. They will review it and they'll make a decision on whether they feel it is reasonable and necessary to review the plan, or whether they disagree and they agree that the funding in the plan is sufficient. I encourage always to have supporting evidence for both of these things. You definitely need supporting evidence for a change of situation, but for an internal review request, you don't necessarily need it. They can use the existing reports and everything, especially if they're all quite up to date and everything. So just quickly, an internal review is if you disagree with your plan, you have 90 days to request a plan review. Evidence is encouraged on but at the very least, the form needs to be completed, and we will make sure that you've got access to the forms and everything with this recording. And then you contact the LAC or the NDIA or email inquiries with the required form from the NDIS website. After the 90 days, you can request a plan reassessment due to a change in circumstances. Or if you get the internal review request, if you submit the internal review request and you get a letter back, which a lot of people do, that says we've reviewed the request and we feel like the supports are still, like, we're not changing anything. We agree with how we've originally funded the plan. We're not making any changes. We're not having a conversation about it. The plan is just remaining the way it is. Be careful in that time, in that 3-month period when you're waiting for the internal review request outcome, you can use the plan as normal and everything. Just be really mindful that more often than not, the NDIA will not change anything with your plan. So try not to overuse the plan. The NDIA have cracked down quite a lot on overusing a person's plan, and you can have a debt raised against you if you're not using the plan correctly. So just be mindful, even though, and I know you're putting the internal review request in because it's not a suitable amount. You can go over that amount a little bit, but just really be mindful that they might not change anything. And so you're stuck with that amount of funding unless you want to do a change of situation after that time, or you can refer your case to the tribunal, which on the letter, it'll give you the options to that. So a change of situation request is submitting the change of situation form, which will again make sure that you have access to. And you can request, you enter in the information. If you've got a support coordinator, they can help you with this. A plan variation is 1 to 2 changes to categories of funding, or it could be changing plan manager, like from self-managed to plan managed, or plan managed to self-managed, or it can be changing an address or something like that. You can put it in there. It can be a change to transport funding, or it can be you need a piece of equipment, so you've got a quote, and you're just submitting that. So it's just a one or two parts of the plan is changing. A plan reassessment is for more significant changes. And I just wanted to explain something here and stop. So coming back to why a lot of people have joined about understanding if a service provider makes changes. If a service provider makes changes and it's within the pricing arrangements and everything like that, and it's how that isn't a reason for a change of situation. However, if a service provider makes changes, you've rejigged the budget and you find we're going to have to cut support down. So that means it's going to put more pressure on informal supports, for example, or mainstream or community. And it is, or the participant's going to be left without support, which is going to increase the risk to that participant. It's potentially going to put more pressure on the informal supports, which they may be unable to sustain, or it may result in a decline of the person's functional capacity day to day, because you're missing out on that program, which is helping to build the skills. That can be a reason for a change in situation. So it can just be how something is worded, but some more significant changes, changes to informal support. So if they're unable to continue to provide the level of support, change the impact of disability. So if there's been a decline, if you're starting a new job or needing different supports, so there's a change if you're moving house, needing new supports that are, more than 1 or 2 things, that is a larger change. If you're traveling overseas for an extended period, or if you're receiving compensation, I've just added these in. Yes, you do need to do a change of situation. If you're traveling overseas for an extended period, they will pause it. If you're receiving compensation for an accident, they may need to review what you're receiving NDIS supports for and make sure it's not a duplication with where you're receiving the compensation. So that's where that comes in. All right, that's all my slides. And so there's some time now for questions. I understand I've given a lot of information. Ali, are there any questions in the chat?
I'd just like to ask one question. With
Yes.
Blood and Chance, you are supporting a number of people with very complex individual support needs. and a number of them have bespoke services. So I expect that that's where the difficulty may come in with these charges, because you obviously have to pay the staff. But are you finding, and you have your support coordinators and all, but are you finding that people with the complex support needs who you are supporting are getting into problems more with their plan reviews now?
Um, so I would say not necessarily. I can't answer for all of the programs.
No.
But I would say not necessarily. I think that sometimes it's harder for the people who are higher functioning, because there's less evidence to show that they require the support when there is uh, needs that can be really strongly justified in supporting letters and reports and everything. It can sometimes be easier for the NDIA to see the supports needed and then put the right amount of funding in it. But you are correct in that all the programs, it is very individualized to the person. So if the person needed more one-on-one or more intensive support, then obviously it's going to look different. And I would just say that and I can speak to this directly, that I have quite a lot of contact with the hubs and with the people who are writing the letters and quotes. And we are always trying to make sure that that is well aligned with what the NDIA require to give the participants the best chance of getting the support the right amount of support that they need.
I know in the first 2 or 3 years of the NDIS, we lost a lot of excellent small services.
Yeah.
So the expansion that your service has done, whilst it was concerning for some people, may stand you in good stead. And I'm finding, particularly with the accommodation service providers, that a number of them are saying that they're going to have to walk away if they don't get, or supporting people with complex support needs. And even where that service provider is operating, for example, in one of the villa models where people have been specifically advocated for and specifically purpose built, they're still having problems with that. So I was just wondering what sort of feedback you're getting about, from your support coordinators and others about, the situation for the complex support needs.
Yeah, it's I mean, yeah, I can't say that it's easy either side of it. I
No.
think that it is challenging for all at the moment, whether you're a service provider or a participant. When it comes to, like, it's essentially twofold. There's lots of the costs being raised, but a big part of it is participants aren't getting the level of funding that they need or that they used to get, and it's getting cut more often than not now. And
Yes.
so but because of the pressure and the changes to the NDIA, providers aren't able to meet the standards or meet the, if they need to be a registered provider or whatever it is. And they're actually, because there are so many overheads now, and because there's participants aren't getting enough funding, a lot of places are having to absorb a lot of the costs, and they don't want to leave the participant without support. And so it's like this real balance. And so a lot of providers are having to walk away. But also, yeah, I think that it's really sad what's happened. But unfortunately, we're trying to kind of navigate quite a lot of change. And so having the only thing that we can do to keep, I guess, the only thing that we can do is make sure that quotes and letters and support is well justified. We put that forward to the NDIA, and that there's enough support around the participant to support them through the reviews that they need to. If you can, I definitely encourage, if you can rejig things in your budget and make it work, whether it is speaking to the service provider or speaking to the plan manager or the support coordinator to help you to do that, and you can extend or roll over your plan as much as possible, you probably are in a better place to not have that cut.
Mm.
But that's where I said at the beginning, and I do stand by it, that best practice would be to make sure you've got updated letters and everything every year. Unfortunately, we can't, it's out of our control, but that's all
There's
we
a
do.
lot more of the full functional assessments are having to be gained now to
Yeah,
ensure that you've got it. And families usually need some help because, and it's staff too, because many of your staff provide excellent support. But in
yeah,
providing that support, they're able to alleviate risk.
yeah,
But if that's not written up in an incident report, you
yeah,
don't have the data necessary. And I know that for a lot of people with complex support needs, what we're having to do now is clearly demonstrate in legal terms an imposition of a known risk at a greater than reasonable level in legal terms for people to be able to have the level of funding that they need. There is a lot more difficulty now.
yeah. There is a lot more difficulty, but yeah, having the data, having the incident reports, having the reports and the supporting evidence, I can't stress that enough. Even still, people do have their funding cut. I definitely acknowledge that, but that puts you in a better place to not have it cut. If you have all of those things. And service providers, I also encourage, like we've talked about, report writing in the past, and reasonable and necessary, and making sure justifications and stuff. And I do encourage having a look at previous webinars to refresh, but feeling empowered to be able to look at a report and go, that's not actually, that's not in line with reasonable and necessary. The justification isn't strong enough here. I need you to write better. And
Yeah.
going back to them and saying, because it does make a difference.
And the reasonable and necessary, the legislation is very grey in some areas around that. So that's another thing. But as part of your presentation today, do you encourage the significant others in the lives of the participants to go and access support of an advocate, an independent advocate? They require that.
I definitely think that having, if the participant doesn't, if feels they need support with feeling empowered and having a voice and speaking up, or having the support and they're feeling overwhelmed, or feeling like that they just don't have the understanding or the knowledge or the skills or whatever it is, and they need help with that, with speaking up, I 100% encourage it. Unfortunately, advocates are hard to find. So that's another thing. But
Sometimes there's a waiting. Sometimes there's
a waiting list. So I would also say there's usually a waiting list for these things. So definitely don't wait till crisis point.
No.
But you can't always see that. So, and I definitely encourage, I find so many advocacy places when I've called them to help support a participant getting a disability advocate, when I've called them, they're so kind and so understanding. And if you give them a little bit of information that you're comfortable giving in terms of the situation, there tends to be a triage thing going on in the background, and they can escalate certain cases and try to fit people in as much as possible. They do their best to do that.
Yes,
they obviously are bound by their resources and their restrictions and everything. And you're usually talking to people who are very caring and they will give all of themselves. So they need to balance it as well. But they are really understanding. So I do definitely encourage it.
Good to hear that. Thank you.
That's okay.
Are we just open-ended asking questions? Or?
Yes, go for it. I can't guarantee I can answer everything, but go for it.
Okay. So just a couple of things I jotted down as you were speaking. Why wouldn't a service provider quote to the maximum of the price guide in the first place?
It's usually them trying to make it as accessible and as as accessible and cost effective for the participants. So they will charge the max they have to kind of keep going and being a viable business.
No, but I mean at the time of a plan review, why wouldn't you quote to the maximum of the price guide?
Because they don't want to, they want to be able to, I don't have the answer for every provider, but usually it's because they want to make it accessible to as many people as possible. So they understand that people's funding are cut left, right, and center. And so they want to make sure that that person can attend service and get the support. But unfortunately, the pressure on the business, they've got to kind of
Yeah, but what I'm sort of saying is if someone's going for a
understand
plan
what you're
review,
saying. I
and
understand what you're saying.
rather than put it, like get to the point where, oh, we can't afford this and have to put it up halfway through, why not quote to the maximum at the beginning? Because I mean, NDIS aren't going to give you it like more than what you quote for.
Yeah.
The other question is, do you automatically increase with indexation? Is that just an automatic thing? So
yes.
Also with NDIS, well, just in my case, so they provided funding for the exact hours face to face. So if I break it all down, they provided exactly enough funding for 24/7 care, whether that be at the SIL provider or whether that be at the day program. There wasn't any excess for not face to face. So I don't know, I've just put that out there. With regard to the invoices you said, so if you're NDIS managed, like I never get any invoices. So where do I get access to those invoices?
So you can ask the provider to copy you in on the invoices. That would be the easiest way for you to get the invoices. You can get it through the NDIA, but I would say the easiest way for you to get it is to just ask to be copied in on the invoices.
One of the other things you said was it's hard to predict non-face-to-face, which is exactly right. So say partway through the year, your person has some kind of issue that causes an escalation in behaviours of concern or whatever, needs some more resources, blah, blah, blah. But if we don't have some prediction of it, how can we go ask for like, rather than having to keep going and asking after the fact, is there no way you can predict and build that into a quote?
So technically that you can, like, you can sort of not necessarily, and I would encourage providers to, I guess, predict.
Estimate,
provide an overestimate of it and just say, you know, we quote 15 hours for the year of non-face-to-face and put in brackets as required or as needed. That's what I encourage providers to do. And that's the same with transport. So some providers have transport to and from. And so they charge for that. And so I say, again, put in an estimate and then put in brackets as required. Because you're not going to charge for it in the service agreement or in the quote. That's just there as this may happen, but this is not, it may not happen. And if it doesn't happen, we're not going to charge you for it.
When you talked about, like, I wasn't quite sure of the term, but like, say, in the core, the going to the day program is not in home and living. Home and living still, right? Is that what you mean?
Home and living is still, yes.
Yeah. So like, again, in our one this time, they pulled out like Saturday and Sunday between 9 and 3 was not included in the SIL. It was put into
social community.
So that can then be flexibly used across the day program, right? If there's excess. Right. Okay. Sorry. 100 days. I wasn't quite sure what you meant by that. If you're within 100 days of your plan rolling or plan finishing time.
So at the 100-day mark, thereabouts, you can either contact the NDIA or the NDIA will contact you by letter or by phone and do what's called a check-in. And they'll go, is your plan working? Are all your goals the same? Do you want to continue your plan? You're eligible for a plan rollover. They're more likely
Right.
to say a rollover if they've got updated reports and everything. They're less likely to give you a rollover if you don't.
Yeah.
So, but within that 100-day mark, you're able to ask for a scheduled plan review, which means you don't need to have a change of situation to request a meeting.
Okay.
Outside of that,
So,
you need to have a reason.
okay. So if you're within that 100 days,
Yeah,
then you don't go and put through a change of circumstance.
correct. You can
Oh,
just
that's
put it
great
in.
to know,
Yeah,
actually.
you can just put in a scheduled review. So you can
Okay.
call them and say, can I have a meeting? I'd like to have a conversation. You don't need to know at that time whether you want the plan varied or the plan reassessed. You can just say, I'd just like to have a conversation because my supports aren't necessarily all working. And then they will book that in. And then I would encourage having all the reports prior to the
Okay.
meeting.
And sorry, just one last question, and you can probably only just give your best guess. But
Yep.
if you do go for that, then within that 100 days,
Yep.
are you saying it, and there's been like a significant, like if it wasn't within the 100 days, I'd be going for a change of circumstance because there's
Yes.
been a significant change in in our case, like escalations of quite dangerous proportion in terms of self-harm, harm to property, harm to staff, and harm to flatmates.
Yep.
Are you saying that there's still a risk that the funding could be cut despite having evidence all to that effect?
Unfortunately, yes.
Okay, so that's bloody scary, isn't it?
I know. It is. And I don't want to sugarcoat it because I don't want to make and say that it's not. It absolutely is. So what I would say and what I say to people when they put in a change of situation or a scheduled plan review or even an internal review, and I'll just make it. So have a look at the reason for it. What is the reason? You just said the reason is for escalations. You need to make sure you have as much evidence as you can to support what you are saying. So if you're saying escalations, have as many incident reports as you can. Take your support. If it's a recommendation letter or if it's a plan, whatever it is, have that. Have quotes. Have as much supporting evidence around you to, and if you're getting letters from mainstream providers or supports, so say it's a GP or a specialist, and I just like it's for everyone, but I'm just sort of saying this because it tends to be medical professionals. Make sure that the letter that is provided is written from a point of view of how the functional impact of the person's disability is impacting on their ability to, say, manage that health condition, or it's been the result, that's what has resulted in the decline. If they speak just to the medical side of it, the NDIA are just going to ignore it.
Can you say that wording again? How the functional...
So you want to make sure that any supporting letter across any provider or any service is in line with the functional impact of the person's disability that they have met access for. And so if someone has, say, diabetes, and they're and that's a health condition, they have not met access for that, but due to their intellectual disability and the impact of the intellectual disability and their ability to comprehend what they need to do to plan it out and all of that is impaired or impacted, the doctor writing the supporting letter needs to speak from the intellectual disability side and show how that is making them is impacting negatively on their health condition.
Okay, so how their disability is impacting on their health condition. So does that include mental health as well?
Yes.
Yeah.
It does. So if they have not met access for psychosocial disability, then the supporting evidence needs to be in line with what they have met access for. It cannot be what they haven't. If you're finding that, say, it's psychosocial disability, but they haven't, it's mental health conditions, but they haven't met access for a psychosocial disability, then it is going back through the, it's easier when a person's already on the scheme. You can put in a change of situation for this, and you can have the supporting evidence to show that, to have psychosocial disability added as a disability. So you can do that. I have done previous webinars on things like that. But
Okay. Where do we access those webinars?
so on the NDI, on the Fighting Chance website, there's
Yeah.
a tab, and Ali, if I get this wrong, tell me. There's a tab that says NDIS, and you click on that, and then it has an education series, and it has a bunch of past webinars.
Yeah. Sorry, I came in late. So are you the sort of lead support coordinator at Fighting Chance?
I'm not the lead support coordinator, but I am a senior support coordinator on the team.
Okay. Okay.
And
because
so
my support coordinator is at Fighting Chance, so you all have access to these same information.
yeah.
Okay, that's fabulous. Thank you very, very much. I hope I didn't take up too much of the question.
No, it's very helpful, and I'm sure other people like that has answered questions for other people as well. So thank you for your questions.
Okay, thanks.
You can always as well put through the Fighting Chance.
So just a quick one, Alex.
Ali, you're breaking up a little bit.
Sorry, my internet's playing up, which is why I was going to say just a quick one. Can you hear me?
Yep.
No.
There was just a question in the chat relating to your point about invoices, a super quick one.
Yeah.
Do people need to request in writing that a provider copy them into invoices to the NDIA?
I would always recommend to have it in writing, yes. I would just write an email, and if it's to the NDIA, just have it in writing. It helps. But yeah, just to the provider in writing, this is the email address. Can you please copy me in on all invoices?
Wonderful, thank you. And then just to add to that, I've put the link to the NDIS resources that Alex is talking about, the previous webinars, in the chat. So just have a look in there for the link.
Thank you, Ali. All right, well, I'm going to press to stop recording.